Hello, my name is Sam Feltham and welcome to Health Headlines. We're starting off this week with junk food in hospitals. Leading cardiologist and Smash the Fat ambassador Dr. Aseem Malhotra has asked the British Medical Association to ban junk food in hospitals. And last week the BMA did vote to start lobbying against hospitals selling junk food and to ensure that all junk food is clearly labelled with health risks. I know some of you might be thinking, but if somebody wants a treat when they're ill, why not? Well, I'm afraid that very junk food is one of the contributing factors to why they're in hospital in the first place in many cases. And when someone is ill, the precise time that they need to be eating good, real food is when they are in the hospital. It's not just the patients though, it's half of the 1.4 million NHS staff that are overweight and obese as well. Dr. Malhotra is admirable in saying that the NHS need to lead from the front. So, I salute you, sir. In other headlines, over 28% of 5-year-olds are overweight in Wales. Now, although this is worrying, and I really appreciate the researchers doing this, but there is still too much emphasis on physical activity from this report. Children have to be in a calorie surplus no matter what, as they are growing. And the reason that they're accumulating fat is because they're eating fake foods, not because they're fat and lazy. Causation with overweight children lies in becoming overweight first and then becoming sedentary afterwards. I'm not saying that children shouldn't exercise or be active, but the emphasis still has to be on eating real food to prevent and treat childhood obesity. And that is only going to happen when we start to put proper policies in place to encourage healthy eating. Finally this week, a study from the University of Otago in New Zealand found that getting up from your desk just for a couple of minutes every half an hour is more effective at reducing your risk of type 2 diabetes than doing just one-off 30-minute walk in the morning. In a nutshell, this study showed that being active throughout the day was better at controlling your blood glucose levels than just a one-off brisk walk. This is great, and I really appreciate the researchers doing this, and I would encourage people to be more active throughout the day because of this, but you know what controls your blood sugar levels even better? Not eating sugar. Something that Diabetes UK are starting to get their head around slowly but surely. But are still having a hard time committing to, despite indirectly costing the NHS £20 billion a year. And I know they're trying to be realistic, but as Dr. Malhotra said, we have to lead from the front. And again, I salute you, sir. That's all for this week on Health Headlines. If you do have any health headlines for me from the past week, make sure that you send them to me by putting a comment below on YouTube or hit me up on Twitter @SamFeltham. And of course, if you enjoyed today, make sure that you subscribe to this very YouTube channel. Until next time, be well and smash it out. Finally, this week, and the reason that but the only way that we're going to prevent and last week the BMA did vote. And last week the BMA did vote to